gonna check out this new lesbian bar tonight. You wanna come?
Why are you setting me up on dates with my team?
I did it for me, for my relationship, out of pure self-interest. You'll do it?
For you.
They said you had a head trauma?
It was a stupid accident.
We need to prep you for your angio.
Valium will help you relax.
I guess I just
Fainted.
House is about as likely to go to a lesbian bar with 13 for Wilson as a child is to take a cookie from a jar in the name of Weight Watchers. Not happening. Very excited to be reacting to House MD's Season 6, Episode 20, The Choice. On this channel, we're reacting to all 177 House episodes, and this will be episode 131. Let's see if I can get the diagnosis before House does as a doctor working in London.
Hey.
Hi.
You sure?
And if I'm not, Ted is a wonderful man, Dad. He's the second greatest guy I ever met.
Do you, Theodore Philip Taylor, take Nicole Margaret Murray to be your wife?
Hey.
I met the neighbors. Good morning.
Hardly. One of my PAs quit an hour ago.
I woke up in the wrong bed this morning.
I have a case.
Sounds interesting. I'll take it.
Phasian syncope.
He can't speak.
Don't say ah. There's one thing they didn't test for. Faking. Ow!
I can talk. My voice just came back right now.
The only thing more surprising than our patient's miraculous vocal rebirth is House expecting to see anything in his oral chasm with no light. But would it matter anyway if the patient's lack of phonation was simply a fabrication? Not really, but I have doubts that it was. Firstly, it seemed like it was the bride that was having her doubts at the start, which probably means that he has been carrying this process and probably is more invested than she is. Secondly, if he was faking, then surely 6 hours in the A&E department, a brain irradiation and a tube down his throat would be enough to extract the truth. The team mentioned they ruled out infection, vocal cord damage and stroke, so for House, let's go out on a whim and say the patient is telling the truth. What then could this be? Something that comes and goes, can't be seen on a CT scan and has no physical damage to the voice box. Metabolic could be hypokalemic periodic paralysis. I've been waiting for that one for a while. Infectious could be herpes encephalitis. Maybe he's not been so faithful and that's why the future wife's instincts gave her doubts about their union. Degenerative could be MS. Usually it wouldn't come and go this quickly, but it's possible. Neoplastic means cancer, so could be a lung cancer pressing on a nerve to his vocal cords and potentially interrupting some blood flow, causing the aphasia and him to pass out. Oh, that would work quite well. Inflammatory could be vasculitis, which could work well here. Maybe he got his voice back because they gave him steroids as they thought he could have had an allergy. That could be what worked just as House stabbed him with a needle. Toxic could be Botox temporary exposure. Maybe he got a top up on his face and ended up being systemically exposed. That wouldn't usually cause this, but definitely still possible. Lots of interesting theories that I'd want to explore. First things I'd do would be a tox screen, chest x-ray, MRI, head and lumbar puncture would for sure be next on my list. Let's get more clues.
What about the syncope?
If you're buying this too, you're compensating for your professional conquests with sexual ones.
You're probably not expecting me to ask you out for dinner tonight. I could do with a down night.
Okay, if you bring your wife.
Fontina at 8:30.
You believe me, right?
Of course I believe you. Ted, what's wrong?
Pleural effusion.
Think his lung is faking it?
Let's say all his symptoms are real. Let's rule out infections ourselves. Tap his lungs, send cultures, run cytology for cancer, and check his blood pressure. You check his love nest. You two check his swinging bachelor pad.
That somebody else now lives in?
That's a suspended ceiling.
Made of 40-year-old acoustic tile.
They're not asbestos. I had them checked when I moved in.
Is he a friend of yours?
He was my boyfriend for 3 years.
Whoa. Makes sense why this episode is called The Choice, since our patient seems to have struggled making one. He was living with a male partner for 3 years until 3 months ago when he moved out, and now is tying the knot with a different thread. Now, of course, the patient will have risk factors for other conditions like HIV or hepatitis, but they wouldn't explain why he has a collection of fluid in the lung. That's especially true as the emergency department has already ruled out infection. What's curious though is that his symptoms aren't really consistent with a pleural effusion, since he has the sudden onset loss of voice, not really gradual onset breathlessness. That means it's a sign of a more underlying systemic condition rather than the crux thorax itself. Lung cancer with nerve involvement would still work pretty well here, but he's quite young for that. I suppose if he did have HIV, that could increase his risk, but his lack of infection symptoms makes me think that the fluid in the lung is probably more watery than made of pus. So what else could cause that? Heart, liver, or kidney failure would do it, but the first two would have other signs, which makes me point my crosshairs at the kidney. Then if we combine kidney, intermittent throat symptoms, and collapse, that does put vasculitis way up on the diagnostic list. Granulomatosis with polyangiitis could potentially do all of those things and would still have the responsiveness to steroids. Maybe he's getting them by accident somehow and that makes him better. That part is a question mark, but there's enough here to shoot my first shot. Granulomatosis with polyangiitis is my first diagnostic guess. Let's get more clues.
I'm not gay. Carter, the guy you met, he's gay. He had a crush on me. I left.
Lung tap turned up mononucleosis. ER doesn't routinely test for it. Explains the PE.
Your immune system is compromised.
There may have been some contact, but I'm not gay. You can test me.
Does it bother me that people hurt others because they're too weak to face the truth? Yeah.
Tell me she's not looking at me.
He's negative?
Yep.
What you didn't tell us is how you turned your life around.
I talked to some people. I had therapy.
They injected him with emetics while he watched gay porn. And when that didn't work, they shot him up with male hormones. And the ECT explains the rest.
Run an EEG, see if they straightened him or just scrambled him. I think you're still seeing the physio.
Please, House, don't tell her.
But you're in a ceramics class?
Friday nights, right?
Taub chose the absolute wrong person to play alibi. If there's anyone he doesn't want to have leverage over him, it's House. Although in all fairness, the moral corruption, comfort with lies and deception does also kind of suit him for the job. Especially when Taub's new Friday ceramics class will be breaking a lot more vases than it makes. Speaking of train wrecks though, conversion therapy camps for gay people. Firstly, I should have realized that he wasn't quite comfortable with himself when he first said he'd made some mistakes in his life, but now needed to turn his life around. That's the kind of thing someone might say when they've overcome a gambling habit or drug addiction, not a sexual preference. So do these camps actually change someone's sexual preference? There's no scientific evidence that they can, and they frequently cause significant long-term physical and psychological harm. Multiple countries have created laws against conversion therapy for this very reason, considering their false claims and even degrading treatment. These can include brain surgery, food deprivation, hormonal castration, and electroconvulsive therapy. Yes, electroconvulsive therapy, which is a fancy way of saying electrocuting someone in the brain. They quite literally do it as a reset so that they can be set back to what would be a more socially acceptable orientation. A 2018 survey by the government found that members of the LGBT community were more likely to be offered conversion therapy if they were from an ethnic minority. Either way, our patient will never see the outcome of his very charged therapy session if he doesn't make it. So what could this mean? Maybe he doesn't have HIV, but he could have a mimic like HTLV1, which has been predisposing him to mono. House suggested that he could be immunosuppressed, which is why he got the kissing disease at an older age than expected, so something must be doing it. Maybe he also has some radiation exposure as a result of his adventures. There's definitely something going on here. I'll need more clues.
What are they doing?
An EEG. You should ask him about it.
Everything looks normal. Beta waves spiking. He's coding. Crush car. He's having a heart attack.
Charging. Clear.
EKG showed no abnormalities. So we'll do an angio to see if his blocks or bleeds.
You should be a doctor.
I'm gonna check out this new lesbian bar tonight. You wanna come?
So why are you setting me up on dates with my team?
I did it for me, for my relationship, out of pure self-interest. You'll do it?
For you.
They said you had a head trauma?
It was a stupid accident.
We need to prep you for your angio.
Valium will help you relax.
I guess I just
Fainted.
House is about as likely to go to a lesbian bar with 13 for Wilson as a child is to take a cookie from a jar in the name of Weight Watchers. Not happening. Our patient has no idea what's happening though, as he is currently out cold again. But what could have triggered it? Well, his fiance is asking him about his head trauma, which was actually brain electrocution due to his covert sexual preferences. 13 already told his future lady wife that it wasn't an accident, but the patient just admitted that it was. That means she's onto his lies, but I doubt that's the trigger as he doesn't know that yet. The moment he actually passed out was when Tao walked in saying, "You weren't discussing wedding plans, were you?" First, collapses at the wedding. Second, collapses after he was released from the hospital and planning to get married. And now the third with this. Are we seeing a trend here? Okay, maybe he isn't intentionally faking, that's a stretch. But there's something called conversion disorder, which is very different from conversion therapy. It's when suppressed emotions, trauma, and anxiety can manifest themselves as physical symptoms. Considering everything about this guy, the triggers for these unconscious episodes and how short they are, it fits fairly well, but there are still missing pieces. Well, why is that? Well, these episodes happen for a split second, then he wakes up like nothing has happened. That mostly rules out seizure. He also doesn't get any warning of it, like lightheadedness or palpitations, which also likely rules out a heart-related cause to it. But, and this is a big but, well, the doubtful, not the Kardashian kind, he has been having physical signs of disease. The pleural effusion, which the team keep calling a PE, which is conventionally the acronym for a pulmonary embolism, a clot in the lung, not fluid around it. Also, the cardiac arrest doesn't just happen because of the conversion disorder either. So maybe we need to try and split the symptoms with the loss of consciousness and speech problems gone. That leaves heart and lungs. His heart also does suddenly stop, which means it could be a familial problem with the pacemaker of the heart, like sick sinus or Brugada syndrome. We also don't know his family history or where his parents are, even though we saw hers. Maybe this is why he inherited it from them. If they did have a cardiac monitor for long enough, they could catch the rhythm, and then a pacemaker could keep him alive with some therapy to sort out the collapses. Seems like it could work, but it's quite a stretch. Let's get more clues.
POTS, postural orthostatic tachycardia syndrome.
POTS can be brought on by viral or bacterial infections such as mono.
So load him up with fluorocortisone.
Cotter Macklin. I'm an old friend of Ted's.
He had a heart attack. You weren't at the wedding, were you?
I wasn't invited.
How did you know each other?
Yeah, we shared a house for a while. I'm sorry. I just miss him.
I think you should leave. Now.
Your numbers look good. We're going to keep you on these meds.
You had a visitor while you were asleep. I need to hear it from you, Ted.
I got really drunk and went to bed. And one thing led to another.
Are you saying you had sex with him?
Fused.
You're gay?
That was the day I went to get help. They cured me, Nicole. Oh, my head.
He's got severe headaches.
So do I.
Cerebral infection would explain the headaches, could have caused POTS. If it's fungal, could have spread to the heart.
Do a spinal tap, run the CSF.
One thing led to another, and before you know it, he was my boyfriend for 3 years. Easily done. He's lucky he got a headache because he trapped himself in a stickier situation than being soaked in honey through a giant spider's web. The headache does make infection more likely, and my suggestion at the start to do an MRI and a lumbar puncture seems to finally be getting put into action. Keep up, house. This is one of the only times I can tell him that, so I'm taking my chance. So where is this going? Well, if he had a brain infection on top of his mono, then that could be the immunosuppressed route, and then HTLV, which I mentioned before as the HIV mimic with a negative test, definitely becomes more likely. The vasculitis can cause more headaches as well. Interesting that the blood counts are always normal here, as they usually do give you at least some clue. Why is that? Well, our body, quite interestingly, uses different components of our blood to fight different things. Neutrophils help break down bacteria, so when their count is high, then we know that an infection is there. Lymphocytes are good for viruses, but if they're really high, it can indicate certain types of blood cancer, like chronic lymphocytic leukemia. Eosinophils have special granules with tiny immune defense explosives that can trigger immune responses, cause allergic reactions, and can try to suppress parasites. So even without tons of fancy blood tests, we can get so much information. I suppose it makes it much more fun when you don't have all that information. Then we need to use our diagnostic acumen a lot more. That's part of the reason why people argue that all of this new medical tech and investigations can de-skill doctors, but I have to strongly disagree with that. It just changes the way that the doctor role works and helps to increase the accuracy of our diagnoses. Having the gold standard answer also helps us to know if we're actually right or not, so we can calibrate our reasoning more accurately for the next patient. This might mean we're more accountable and exposed, but if the trade of that is for our patients being more likely to get better quickly, then that's one I'd take any day, and so should every doctor. It seems like our team may have more clues for me soon though, so let's see what they are.
If your gaydar is so great, how come you didn't know about the patient till he met his boyfriend?
He may love her, but he needs to have sex with other men.
CSF was negative for infection and his headaches are worse.
It's not POTS, we're back to square one.
Not quite. He's losing CSF from the tap side. Patch the leak, top him up with artificial CSF.
Everything's gonna be okay.
He's stroking.
Both eyes are responsive. This isn't a stroke.
It's what's masquerading as a stroke.
MRI showed no problems with blood flow to the brain. What about Mealis?
Lactate levels are stable. We're missing something. We call the boyfriend. Let's get them all in the same room.
Drinks are our main foreman tonight. We don't want to do it either, but Wilson already paid us.
What about sex?
No problems?
There have been some
Nick.
issues.
Erectile dysfunction.
We never had that problem.
A penile plethysmograph measures changes in blood flow in your penis.
Oh, they've stepped on interesting territory here, plethysmography. That tells researchers what kind of stimuli are causing arousal to the person, as a stretch-sensitive sensor is placed on a man's trouser tiger. They then provide the stimulus and see the response. Maybe he isn't responding to his lady friend because he's not quite into that. Or maybe it's because he actually has a medical condition like a vasculitis, which is affecting his brain, lungs, heart, and now penis, which it didn't before. The first makes for a good story, but the second definitely tingles our diagnostic senses, even if his tingles are reserved for dongles. Well, historically, if they wanted to check a sex offender's chance of reoffending, part of their parole could include being able to pass a penile plethysmograph to see how stimulated they are by their problem paraphilia. The issue with that is that this was found to be relatively inaccurate at being able to predict reoffense rate, even though it was more accurate than many other methods which are still used. In one famous case, it was deemed unlawful. Why? Courts thought it was non-routine manipulative intrusions on bodily integrity. That means less intrusive methods should be used rather than this procedure, which was likened to a device from a George Orwell novel. Either way, our patient won't be reading any novels if we don't save his life and manhood. Do you think penile plethysmography should be allowed for sex offenders? Answers down below.
What's your pleasure?
I don't think anything's gonna work.
Then we'll have to give you a shot.
Shot it is.
Nobody wants to follow that.
Night just keeps getting better.
Everything looks fine.
Feeling feverish? You're sweating. You're not sweating.
You're lactating.
How's he gonna tell her he's pregnant?
Male hormones don't make you lactate.
TSH was normal.
Pituitary tumor could also explain his libido and heart issues.
Check his prolactin level, then MRI his pituitary.
In over 100 episodes of House, I've seen them do some disgusting things. Pulling a cow eye from a man's vomit, digging up a grave, pulling out a 25-foot tapeworm from an intestine, but I never thought he'd be adding the consumption of male breast milk with his coffee to the list. It does make for an interesting clue though, as we know that a hormone called prolactin is what stimulates that lactation to happen. One cause of that is a tumor, which of course the team are considering here, but there's another cause. Whoa, wait. I think I might have just cracked this case. Antipsychotics. They raise prolactin levels through interactions formed by inhibiting dopamine levels in the brain. What if he has an ongoing prescription for one? Or he's getting an older generation one illegally, which is causing all of his side effects. If he was taking something like haloperidol, for example, that could in theory make his POTS worse, cause arrhythmias, cardiac arrests, lactation, and his trouser sword to stay thoroughly out of the stone. Maybe he thought he needed it because he thinks that being gay makes him psychotic, which obviously it doesn't. There's actually even some heritability associated with being gay, but the quoted range is anywhere between 8% and 60%, and there hasn't really been a gay gene identified. What that does tell us though is there's more to this than just someone's choice. That's probably the reason why the episode is called The Choice, since Universal are making a statement here about how there isn't really one. Well, unless you're wired like 13 and then the world is your oyster, or other shaped nutrition of choice. Either way, our patient won't live to make his menu choice unless we figure this out. I'm pretty sure I've got enough here to go with secret antipsychotic use as my third and final diagnostic guess. We are locked in.
They had fun with you.
I realized that they could be my friends and that I sobered up. And wisdom is knowing the difference between what you can change and what you were born with.
Pituitary MRI.
What's normal? Give me your head.
It's better. Okay, enough.
You have a Chiari malformation.
Proper treatment is surgery.
So, how did I get this thing?
Like so many other things, you were born that way.
Ted, this is a mistake. I'm talking about hurting her.
What do you say we rebook the church?
I don't know, Dad. I think that you still love him. I'm sorry.
You wanna grab a bite to eat?
Not that hungry.
I just want us to be friends.
That's the last thing I want us to be.
A patient's life was saved and a doctor's life spiraled. I have the good fortune of finding a decent balance with work for now, but an old colleague of mine said his day as a doctor felt like every patient who came in had a monkey on their shoulder that would end up on his. When he'd go home at the end of the day, he'd need a way to get rid of those monkeys so the weight wouldn't break him. Doctors need a pressure release valve. For some, that's cycling. For others, that's pottery. But it's no wonder that when that valve is hidden in a darker place, it explains why physicians have one of the highest drug and alcohol abuse rates of any profession. House is a fictional character, but some of the struggles he goes through are anything but. He definitely gets the job done though and has beaten me again. Arnold Chiari malformation. Oh, there is zero chance I would have gotten that. The bottom of his brain basically was peeking out through the big hole in the skull called the foramen magnum. When he had his camp conversion therapy and they shocked him, that swelled the brain and blocked the flow of the fluid, leading to all his symptoms. Spicy for sure, but not quite believable that it would cause the pituitary problems. That bit was just for the coffee topping, which he didn't drink, by the way. Interesting episode overall, but there are definitely better ones in season 6. I'd say 7.6 out of 10 entertainment, 7.1 out of 10 accuracy, and 6.5 out of 10 diagnosis. This episode doesn't make full sense until you watch the previous one, where a patient's open relationship raises some questions here.